So what we're looking at here today is we're going to try to open up your palm. We're going to do 18 muscles in the palm here. So we're going to take a look at your thenar, hypothenar eminence, and we're going to look at our lumbricals and through here, and we'll do an extrinsic flexor stretch afterwards. So with the HawkGrip instruments, instead of using your fingers and hands, you can fit the tool to the body part. So now I'm going to actually frame this hand using a nice light technique, and you can move from this position here right down into the forearm and the wrist. Place them on an extrinsic flexor stretch and stretch at the same time, and coming back the opposite direction, work right up over the hypothenar eminence into the palm. Then you can use the inside aspect of the tool, the instrument, to really frame around that thumb. What I'll do is get into the thenar eminence, use the little bottle opener, or the little tongue depressor here, right here, and do a J stroke into the palm to really loosen that up. So it's just really good for your post-op carpal tunnel releases. So working in that palm, J stroke, and brush back and forth and through here, and then you can go ahead and do your scar lifting and nudging, lift that up. One of the other common things I'll do for is with osteoarthritis, this adductor. The adductor gets very taut. And so what will happen is you'll get this dorsal subluxation of the first metacarpal off the trapezium. So in order to loosen that adductor, what we used to do, we used to pinch and hold this right here. So instead of pinching and holding and causing thumb trauma and pain on yourself, what we'll do is we'll go ahead and open this up. So then I can take the double beveled edge or single and get right down into that adductor and loosen that up. So instead of pinching and holding, I can go ahead and pull down into that to do a release. I can do contract and relax with that thumb at the same time, bring them out a little farther, and really just open that up. It feels really nice. Then I can go ahead and work my dorsal first interossei along the side of the hand here. And I can loosen that muscle up really nice. Then I can go ahead and do my stabilization exercises. Raise your index finger up for me in this position, so straight up, and back down again for me. I can do those. Open that hand back up and go to the opposite side again. And what's nice about this is I can get right down with this carpal tunnel tool, get right in between the metacarpals. So I can work the metacarpal heads, the deep intermetacarpal ligament. Say if you have a boxer's fracture or any kind of metacarpal neck or head fracture, to mobilize this soft tissue. Do some AP glides, some AP molds. And again, work right in that palm. And what I'll also do many times is to open this palmar fascia up a little more, is use the concave on the convex surface and just frame that and open that right up. And again, it's a relatively gentle technique. Yeah. And then change tools. Again, open them right up, right down to the forearm.